So I'm Dario. I'm a physician and an infectious disease specialist. The signs, symptoms and signs that a patient will develop be helpful for the health team giving assistance to those first patients in the primary care or urgent care, especially those who are related to the liver function. So if you have hemorrhage, for instance, that's a very obvious, very serious warning sign. But you might also have more subtle breathing rate, accelerated breathing rate. That might be something that might give you a hint that this patient is developing acidosis. You might also have lower kidney function. So you might have oliguria, you might have a lower urine output. Those signs, together with a lower conscience level, like somnolence, sleepiness, convulsions, coma, a lower Glasgow scale, all those signs indicate that this patient is developing warning signs, and therefore you should classify them at a higher strata. We would call those group C, and those are patients that should be in an ICU as soon as you can. So the other very helpful tool that we must have, is lab results in order to stratify those patients. They might be useful even for diagnosing the yellow fever suspicion. So if for instance, you have this arbovirus-like symptom on those patients, and you're trying to think if this is yellow fever, transaminases will be very helpful for you, because yellow fever does run with a very high level of transaminases, especially TGO. This is not only helpful for diagnosing and for raising your awareness for yellow fever, but it is also very useful to stratifying the liver injury that yellow fever is causing, and therefore if this is a more likely patient to have a severe form of the disease. Also, not only liver function exams or proxies of it, like INR, serum bicarbonate. Those are exams that will tell you if the liver function is starting to be very severely compromised, but also kidney function might be very useful. Even though it has a very late presentation, it might also be useful for you to stratify those patients. So the minimal access to tools that you need to have in a primary care or urgent care in the forefront of this yellow fever epidemic: a hemogram and basic lab tests like creatinine and TGO and TGP. So you need transaminases as a basic liver function or a measure of liver injury, and you need proxies for kidney injury. More important than anything, you need a way to access, you need transaminases, you need a way to access liver function and transaminases. This is a way for you to understand yellow fever as it is, as a very severe form of fulminant hepatitis, and you have to think that if you're thinking of yellow fever, you ought to get those patients to a higher complexity sort of care.